In the course of this, our legislative duties and committee activity, we discover some cross-cutting challenges faced by the specialty healthcare provider and institution in Nigeria, like infrastructure decay, lack of prerequisite medical equipment, poor electric power source to supply, and poor inadequate funding. The committee sadly note that the specialty hospitals and healthcare centers serving the nation as a referral hospital on specialty health emergency are the lowest funded in the health sector budget. The committee therefore invites you all here today as a professional and expert to review the draft legislative activity implementation framework, make your observation, contribution, intervention, and input on the document. Let me also use this opportunity to call our development partners, NGOs, CSOs, to identify and take up opportunities provided by this framework to support the committee for adoption and implementation of the draft framework. I wish to, on behalf of the committee, appreciate the support from the CBN by providing banners and writing material to the Secretariat for this roundtable and strategy meeting. The committee therefore look forward and call for more collaboration and technical support from interested development partners, NGOs, CSOs, and the private sector to facilitate the adoption and implementation of this legislative initiative by Specialty Healthcare Committee of the House of Representatives.
Because of cost, but sometimes it's because of ignorance. And so he went to traditional bone centers, they complicated the problem. So he came back to me and I was treating the complications of traditional bone centers. So, and it's more costly and more complicating when they have gone there before coming. So we need some form of regulation of orthopedic practice so that we don't have unnecessary amputations, unnecessary complications from interventions from these our friends.
On the issue of power supply to healthcare institutions, I think it's another area that we need to look critically at. With good legislation, again, maybe I don't know how that will happen. Maybe if it's possible to somehow do some advocacy or sometimes compare some of the distribution companies to supply energy to healthcare institutions at subsidized rate, because with the way things are going, by the time the tariffs are increasing, it is becoming increasingly difficult for some institutions to sustain some of these. For example, somebody that is in ICU that needs ventilation, that is on ventilation, mechanical ventilation, there is no way, even for a second, that you allow power to go off from that ventilator. Otherwise, it means that the function of that ventilator for the patient. So it's an area where with good legislation we can encourage the distribution companies to subsidize